Hi, how are you today? I'm very glad to have chance to treat you on your picture. Before I start the treatment, let me explain briefly how I can treat you on the picture. Usually your picture entangles to yourself by the Wi-Fi entanglement physics phenomena. This is known as the entanglement of origin and other quantum by the universal radioactive particles, resonance and vibrations. And we call this phenomena as quantum entanglement in quantum physics. So let me explain in a little detail. So the human being or all the creatures, they have their own third dimensional body. So the third dimensional body or all other holographic being, we refer to you or the origin of that creature. So you are the origin of yourself, and your pictures is the quantum of your being. And your origin and your picture or your voice, those kind of quantum, they entangled together by Wi-Fi vibration. So in detail, if you want to learn more about the quantum physics or quantum entanglement, then you can look for a lot of materials internet. So briefly I explained. So today I determined your body's condition by the abnormality of your biorhythm. So as I told you, your body entangled with your own being, and I have special tools to determine your biorhythm's abnormalities. And that's how I determined what kind of problem you have and what kind of symptoms you have. First of all, I found this kind of pattern around your energy field, the yellow dotted area. So actually it is around your energy field, your front energy field. So right front, left front, and your energy field on your back side. So our human body is three-dimensional being, but since I treat on the two-dimensional flat pictures, I had to put the dots around your body like that. So let me see what it was. Oh, sorry. I found this today, but I found something else before today on your picture, on the pink dotted area. Actually, your friends or whoever referred you to me, one day she gave me SOS, like Dr. Ahn, this man had really difficult breathing. So he cannot breathe really well and it is emergency. Is there anything I can do, or is there anything that you can help him? So I look at his picture and I connected to his body's biological vibration, and I found something going on in the pleural cavity, means your lung area. And that time I briefly wrote a message to her I found some bleeding internally in the lung, and I recommend her to take this patient to the emergency room because my test said it's very urgent. It's better to get emergency care. So that's why I put this red dot on the other day. So let me explain on the red dot first. As I told this patient's acquaintance or a friend, I found he has bleeding in the lungs, so both lungs bleeding internally by radioactive particles inhalation, by the rain falling into the pore of skin, and through the wet clothing. That's what I found. So let me explain what it is. So this patient, you have some bleeding in the lung, and that's why you have a constant runny nose, because your lung function is very damaged and it does not perform its right function. And usually runny nose, we think it is flu or cough, cold. And that's right, it is related with a lung function. So your lung does not perform the right function because you have radioactive particles and you have some bleeding in here. So how you got it from? From the rainfall. And my test said that it is not only the nose, but mostly it got into your pores. When you get the rain on your bare skin, or when you wear the wet clothing with the rain. Because nowadays the rain contains a lot of radioactive particles, very, very fine, minute radioactive particles. Especially you live very near to the Pacific Ocean, and your area has lots of rain year around. And usually people, especially men, they don't carry umbrella all the time. Or probably they ignore to wear umbrella because it is just drizzling, very little rain. But unfortunately, the rain contains lots of radioactive particles. So I'm gonna explain how it happens. So I got some. Human has about 10,000 number of the pores all around our skin. And usually humans pore size between 20 to 50 micrometer. So approximately our pore size is 30 micrometer. But the radioactive particles size is usually smaller than 0.5 micrometer. So very, very small comparing to our pore. Or some of them even very small as the size of nanometer. Nanometer is very small, small, means I just put. So fracture 1/1 billion. It means 1 meter divided by billion number. It means we cannot imagine how small it is. And that is the nano size. So radioactive particles usually very small size, and whenever you get wet by the rain directly on your skin, your big pore observe them right away. Then underneath of the skin and pore, there are tons of capillaries are distributed under the pore. So as soon as you get wet by the rain, which contains the radioactive particles or radioactive dust, they go into your bloodstream. And then they go to your, of course, heart. In your case, skin pore is kind of breathing organ. So we only know breathing organ as our lungs, nose, or such things. But actually, the biggest breathing organ is skin, because we have a lot of pores. So that's how your body say your breathing through the pore collects all the radioactive particles, and it went to your lung because it is breathing the headquarters lung. So that's why you have bleeding there, and that's why you have constant runny nose, and that's why you have very difficult breathing. So your friend told me that you used to use the inhaler about for 10 years, but last very acute episode of very difficult and shortness of breath, you went to the pulmonary doctor and you got other inhaler, but it didn't seem like it helped you much. And yes, I can guess that because you have a little deeper problem of your bleeding in the lung and the radioactive particles. So before the treatment, I determined your biological energy spinning to see if your lung perform right function, and your lung did not functioning right. And since it is your first time treatment, I'm gonna introduce a little instrument of the pendulum. So you see this little ball. It is nothing but a metal ball. This pendulum is kind of ball, and it works as like a fan, you know, fan. So I want to visualize your energy circulation, and that's why I use little instrument of the pendulum. Okay, let me explain on my palm energy. Human cell, every kind of cell reveals their biorhythm or biospinning energy. And that is exactly same as the electricity, which is connected to the fan. So we know fan. Whenever the electricity is connected to the fan moves around, and we know that part. So invisible electricity energy moves around the fan. And whenever the energy is disconnected, the fan does not move. So that is very same phenomena. This little instrument pendulum moves around on top of the human cell, which is really vibrant and really good biological energy. It's like the fan is moving by the electricity. So I'm gonna show you what I just told you. So I'm gonna test my palm energy, okay? And I'm gonna put this little instrument pendulum on top of my palm. So this little instrument pendulum is moving around on top of my palm center. And my right hand, which holds the pendulum, does not move at all. My right hand stays still, but the pendulum is moving around the clockwise spinning circle. It means my palm center reveals my very intact and healthy. And it's getting bigger and bigger. It means my energy is very healthy and strong. So every human cell has their own energy spinning movement. And if you have any ill or sick part, then your biorhythm or bioenergy spinning frequency or spinning energy stops or blocked. So that's how I can determine on the spot you have good, healthy, intact energy or blocked energy. Okay, so that's how the pendulum works. So our energy is invisible, as like electricity, not visible either. But we can see the electricity connected to the fan because of the movement of the fan. So same phenomena. Your dotted area with the pink dot, it was blocked in the beginning before I treated you. But after the treatment of the deleting of all the radioactive particles, and later on it's gonna stop bleeding automatically if you don't have any more agent to bleed you. So this long part, you had internal bleeding. And that's why you cannot perform the respiratory function, because the headquarters of respiratory system, lung, did not perform its right job. But after I eliminate the radioactive particle, your lung starts performing its right function. Okay, so now your body will continuously work for it, and my test said that it's gonna take 5 weeks to complete all of the radioactive particles eliminated from your body. And gradually, your constant runny nose will get much better. And of course, your breathing will be better because the causative factor is eliminated. So you can continuously use the inhaler. I don't say stop using it. It may help you, but the root cause must be treated, and that's what I did today. So after 5 weeks, all of them will be cleared and your lung bleeding will stop. Good. Now the second one that I found today. So yeah, I first showed this part. So this one, the thing that I found it today. Okay. Okay. Now let's see what it says. Also, yeah, it is also radiation. Okay. The other one was radioactive particles or dust. But this one is radiation to the ground from the rains. Also, it is from the rains. And they are in the energy field of you. I previously told you. All around your energy field, and emit the radiations. So the radiation is ray, beam, like ray, X-ray, gamma ray, the ray, okay? They emit the radiations that rupture the blood vessels at legs. That's what I found. So actually the rain dropped to the ground, and by the damp air, it comes up and it surrounded your lower body energy field, and they emit the radiation. So radiation is very harsh. It can harm or it can kill, but it ruptured your leg blood vessels of vein. And also it is not only from the rain. Since you live by the Pacific Ocean, also continuous emission of radiations from the Pacific Ocean. So you have a lot of rain in your area. Also, you are very close to the Pacific Ocean. So that's why you got actually attacked by lots of radiations. And that's the reason of your symptoms of leg weakness. So your friend said that your legs are sleeping, but my test said that leg weakness and leg cramps. So you have a lot of cramps. So in the morning you must walk or whatever movement, then your cramps go away, something like that. So you have lots of cramps and leg blood clots in veins. Okay, you have a lot of blood clots in your leg veins, and that's why you have all those kind of weakness and cramps and those kind of symptoms. So I treated all of them, okay? Before the treatment, all around your energy field, your biological rhythm did not reach because all those spots got occupied by the radiations. But after the treatment of the elimination of all the radiations, your energy field right away unblocked. Now it is open. And it's gonna take long time to eliminate all of them from your body and energy field. So I think you exposed yourself so long time under the rain in your living area, the Pacific Ocean. So it is not very recent happening. It's been a very long time. Especially in 2017, we had a lot of like a missile fall into the Pacific Ocean. And we had a lot of volcanic eruption in Hawaii and in Pacific Ocean. And usually volcanic eruption accompanied by the radiation emission. So seashore is very beautiful view-wise, but nowadays it is very dangerous because the Pacific Ocean is the reservoir of all kind of radiations. So that's why you have a lot of damage on your leg vessels, especially in vein, and a lot of blood clots formated, and it blocks your blood circulations. As the result, you have cramps, weakness, etc. Okay, so I treated all, and it's gonna take time to eliminate everything because it's been so long time, but after 5 weeks, you are not gonna have any of them left over around your body. Around your energy field and inside of your body. So I have to give you some kind of feedback at this moment. Since you live in around Pacific Ocean, and since you have a lot of rain year around, please cover your body. Don't expose your body under the rain. Otherwise, the recurring, all those kind of symptoms, you will have it constantly. So after the treatment, but you have to cover your body and carry the umbrella. Try to avoid the direct contact of the rainfalls. Okay, thank you. Now the green dot, that is the most important thing that I found today to affect your body condition. So I found some kind of green, some kind of green dots around your abdomen area and your left side of brain. So that is your left side of brain, and some in the heart. And let me read it first. So I'm gonna read what I found. My finding says these green dots are infection and inflammation by some virus and a virion of bubonic plague, by mountain fires all around neighboring regions. So that's what I found. So, sure, bubonic plague infection at abdomen, your brain, your heart. And it came from the mountain fire. I was told that you or your neighboring regions like Canada or LA has continuous fire, mountain fire. And of course, your region got affected by their fire dust. And that time, the bubonic plague was carried. And that's how you got infected by them. So, my major concern is this bubonic plague infection gave you very specific symptoms of precancers. So please don't be too much don't be too much surprised. Nowadays, a lot of people, most of people carry some kind of cancers or precancers or cancer seeds, and so do you, and it is due to bubonic plague for you. So cancer seeds by the bubonic plague infection, maybe you didn't denote about your symptom of your abdomen or stomach. So I don't know what kind of, maybe if I do the detailed test, I may know. But your major danger was in your heart. So anyway, it started from your abdomen and your brain. So this part, your side and top part, you have the precancer at the cauda nucleus. So we have many brain parts: big brain, frontal brain, and pineal gland, pituitary gland, thalamus gland. Those kind of the brains are very important, but you have the precancer at your cauda nucleus. So this nucleus is the headquarters to control your internal organs. And cauda nucleus is the headquarters of controlling your 12 pairs of cranial nerves. So you have precancer at the cauda nucleus. It failed to control your heart function. So, okay, let me see what kind of heart function you had. So you had precancers around abdomen and brain at cauda nucleus. It controlled the heart pumping node of AV node. AV node is atrioventricular node. Okay, so we usually, these nodes give you your heart the signal, like a signal. That's how you have like pumping. So this signal is very important, and there's other node like SA node, and we call it pacemaker. So you are familiar to pacemaker. These are natural pacemaker, and it is not controlled by your brain. And that's why you had very difficult breathing and very shortness of breath several weeks ago. So this is the reason of the recent breathing abnormalities of very acute shortness of breath. And you may remember, so you had so emergency situation. And I found this is the very dangerous for sudden death, cardiac infarction. Cardiac infarction means we call it like heart attack. But the cardiac infarction means your heart stops supplying blood to your heart itself. Then your heart stops. Then the first symptom is chest pain, but mostly very difficult breathing and shortness of breath. That is the first symptom of your heart attack or cardiac infarction. And that's what you had several weeks ago. So I'm glad you are okay. Maybe you didn't go to the emergency room, but you went to the pulmonary doctor. to get new inhaler. But originally you have the AV node infarction due to the bubonic plague. So before the treatment, all these spots of that is they are the precancer sites. Of course, bubonic plagues variants are there. And in the beginning, before the treatment, the pendulum did not move. But after the treatment, your biological rhythm resumes. And you see the clockwise circular spinning mode of your biological rhythm. You visualize by the pendulum's movement. So that is your abdomen area, and that is your cauda nucleus area of your brain. So it is kind of left side and top. And as the result, you have AV node. So it goes to the counterclockwise vibration and very dangerous. But after the treatment, your biorhythm recovers and it shows the normal clockwise spinning energy motion. So all this treatment will take 5 weeks to complete all the conditions. Today I unblock all the blocked your functions, and you're gonna feel much better gradually. And it's gonna finish after 5 weeks. And there are some other miscellaneous things, because we have a lot of pollutions and a lot of pathological agents in the air and atmosphere. So after 5 weeks, there may be some other agents that I must treat in order to maintain this condition well. So in the meantime, please avoid the rain directly and enjoy your holidays, and please be in happy time, and I'll see you next year. Thank you very much.